Because you would have checked the person's blood pressure early, start the arm examination by inspecting his hands. Note the color, the skin and nail depth, as well as the skin's temperature, texture, and turgor. Check for any edema or lesions. The arms should be the same size, with no scars or other lesions. Also, view the fingers in profile to detect clubbing. Normally, the nail bed angle is 160 degrees.
Okay, great. Now I'm going to feel both of your pulses.
During palpation, assess the radial pulses, noting their rate and rhythm. Grade the pulse amplitude on a 4-point scale, in which 3+ is a bounding pulse, 2+ is normal, 1+ is weak, and 0 is absent. Next, palpate the brachial pulses in the antecubital fossa, just medial to the biceps tendon. They should be equal bilaterally. Then palpate each epitrochlear node by supporting the person's arm, reaching your other hand under his elbow, and feeling in the groove between the biceps and triceps muscles above the medial epicondyle. Normally, the epitrochlear node is not palpable. Repeat the procedure on the other arm.
Okay, great. I'm going to check the arteries in your hand.
Finally, perform the modified Allen test to assess radial and ulnar artery patency with the person's palms up. Compress the ulnar and radial arteries of one hand and have the person make a fist several times. His palm should blanch. While keeping the arteries compressed, have him open his hand. Then release the ulnar artery only. The hand should turn pink in 2 to 5 seconds.
Okay, great. Mr. Malik, I'm going to have you lie down now so I can examine you.
To examine the person's legs, have him lie down and drape his genitalia while exposing his legs. Then inspect both legs, noting skin color, size, including swelling or atrophy, hair distribution, venous pattern, and any lesions or ulcers. The leg color should match the rest of the body, and the legs should be symmetrical and evenly covered with hair, and have a flat, barely visible venous pattern with no lesions. In an older person, you may see trophic changes, such as thin, shiny skin, thick, ridged nails, and hair loss on the lower legs. These changes are usually caused by arterial insufficiency, but can also result from normal aging.
Okay, I'm going to take a look at your legs now.
Diabetes mellitus is common among blacks, Hispanics, Native Americans, Aboriginals, and obese individuals. In these people, be especially alert for leg vessel changes caused by diabetes, such as coolness, pallor, diminished pulses, thin, shiny skin, and foot ulcers.
Great. Have you bend each leg slightly?
If the lower legs look asymmetrical, measure the calf circumference with a tape measure held at the widest point in the same place on each leg. The measurements should be within 1 centimeter of each other. During palpation, assess the skin temperature, comparing symmetrical spots. The skin should feel warm and equal bilaterally. Now test for calf tenderness by flexing the person's knee and gently pressing his calf muscle against the tibia.
Now, does this hurt or feel tender?
No. This maneuver should cause no tenderness.
And how about this one?
No.
Great.
Then palpate the inguinal lymph nodes.
Okay, Mr. Malik, I'm just going to feel the lymph nodes in your groin now.
Okay. If palpable, the nodes should be 1 centimeter or less, movable and non-tender. Next, palpate the peripheral arteries, starting with the femoral pulse. With your fingers just below the inguinal ligament, halfway between the pubis and the anterior superior iliac spine, press firmly and then release slowly. If the femoral pulse is difficult to find, such as in an obese person, ask him to bend his knee to the side in a frog-like position. Next, Assess the popliteal pulse. With the person's leg extended and relaxed, anchor your thumbs on his knee. Then curl your fingers around behind it and press the artery against the bone. Usually, the pulse is just lateral to the medial tendon. If you have difficulty finding the popliteal pulse, turn the person over. Lift his lower leg and rest it against your arm. Then press deeply into the popliteal fossa with both thumbs.
Okay, Mr. Malik, I'm going to have you lie on your back again.
For the posterior tibial pulse, curve your fingers around the medial malleolus and press gently. You should feel the pulse in the groove between the malleolus and Achilles tendon. If not, have the person dorsiflex his foot to make the pulse more accessible. For the dorsalis pedis pulse, lightly palpate just lateral to the extensor tendon of the big toe. Remember to palpate the posterior tibial and dorsalis pedis pulses on the opposite foot. All pulses should feel regular, 2+ in amplitude, and symmetrical bilaterally.
Okay, now I'm just going to check for swelling, okay?
Next, check for pretibial edema. Firmly depress the skin over the tibia or medial malleolus for 5 seconds and then release it. Normally, your finger should leave no indentations or pits. In a pregnant woman, you may see diffuse bilateral pitting edema, especially at the end of the day and in the 3rd trimester. Although this woman doesn't have varicose veins, you may also see them, especially in a multiparous woman.
Okay, great. Now I'm going to have you stand up and face the exam table, okay?
All right.
Great.
Next, have the person stand so that you can assess his leg veins.
Perfect.
They should not be visible, dilated, or tortuous.
Mr. Malik, now I'm going to examine the veins in your lower legs, okay?
Okay. Although this man doesn't have varicose veins, use the manual compression test to test varicose veins for valve competence. With the person standing, place one hand on the lower part of the vein and compress it with your other hand about 15 to 30 centimeters higher. Your distal fingers should feel no change.
I'm just relaxing my back.
All right. Use additional techniques to assess possible vascular problems in the legs.
I'm going to raise both your legs on my arm.
For example, if you suspect an arterial deficit,
Just wiggle your feet around for me a little bit, if you would.
check for postural color changes. With the person supine, raise his legs about 30 centimeters off the table and have him wag his feet for 30 to 60 seconds to drain the venous blood. In a light-skinned person, this may cause the feet to look a little pale, but they should still be of normal skin tone. In a dark-skinned person, postural color changes may be difficult to see. However, extreme color changes should be visible on the soles.
I'm going to ask you to sit up.
Now have the person sit up and dangle his legs over the side of the table. Compare the color of both feet, and note the time it takes for the color to return to them, usually 10 seconds or less. Also note the time it takes for the superficial veins in the feet to fill, usually about 15 seconds.
Great, now I'm going to ask you to lie back again.
Okay. If the leg pulses are weak, use a Doppler ultrasonic stethoscope to magnify it. After putting coupling gel on the handheld transducer, place it over a pulse site, swiveled at a 45-degree angle. You should hear a swishing or a whooshing sound. To determine the ankle brachial index, place a blood pressure cuff above the ankle and determine the systolic pressure brachial artery in both arms and use the higher number. To get the ankle brachial index, divide the ankle systolic pressure by the brachial or arm systolic pressure. The ankle brachial index should fall between 1 and 1.2. An index of 0.9 or less suggests peripheral vascular disease.
Well, that concludes our examination for today.
Great.
Do you have any questions for me?
Once you're done examining the peripheral vascular and lymphatic systems, discuss your findings with the person and answer his questions. Also, teach him how to promote his health and provide self-care.
Well, that's actually pretty good.